We're in the middle of the third wave of the COVID-19 pandemic. Current case numbers are being complicated by variants of the virus that were not a factor in the first and second waves. Dr. Karim Ali joins us. Dr. Ali, Niagara has had over 2,000 cases of the UK variant, but so far the Brazilian and South African variants have not taken hold here. Why do you think that is the case?
From what we have learned about the variant that was first identified in UK, or B117, it is more fit to spread, right? So when all these three viruses are, these three strains are in the mix, the survival advantage is with the variant that was first identified in UK. That's why we are not seeing the B1351 and the P1 variant as much at this time. You know, not to say that we won't find it, we will eventually, right? Like we keep looking. But yes, 80% or 90% of the VOCs identified in Ontario are actually the B117 variant right now.
When you look at these three variants together, is there one that is more of a concern than others, other than the fact that this UK variant is spreading much more quickly? Are any of them more resistant to the vaccines?
So there is more data that the antibody responses to the variant that was first identified in South Africa, the B1351, and the variant that was first identified in Manaus, Brazil, may have reduced antibody levels to some vaccines. But overall, what has happened is in vaccinated individuals, even if they have become infected with the variant, the disease has been mild at best, if that. No deaths and no severe illness and no ventilation. That is absolutely the key part to understand.
So really the big concern about the variants themselves is the fact that they just spread much more quickly than the original COVID-19 virus.
Yes, the OG, yes.
The OG.
The OG, the old COVID-19 variant. But, you know, like we have talked before, you give the virus a chance to spread and replicate. This is what the virus will do. It will find, right? Like it's Darwinism in action. You will see that. But what I don't want us to lose sight of is, you know, this variant was first identified in UK. Yes, it is infecting younger people, and we are seeing this, and it's infecting people much quicker. But look at what UK achieved with one shot, right? Like, so they moved to a policy, we are gonna vaccinate as many people as we can with the first shot and talk about second shots later on. And there, you know, the post-Christmas surge that they saw, right? Like that just plummeted. And it's absolutely heartwarming, right? Like, and that's the thing that keeps us going. When we look at how busy our ICUs and our teams are so busy with all this, now you see in UK, they're closing down their COVID ICUs, right? That's something that I want us to look at. And that's what I was saying. You know, we are in the home stretch. Literally, we are in the home stretch at this time. The next 2-3 weeks obviously are going to be tough, but the tide is already, we are already making that turn. Not to let your guard down, get the first shot available to you, because there is precedence. This is going to help us get out of this.
You mentioned how these variants have affected more younger people, and that is a big concern because it, especially in the first and second waves, it was those younger people that seem to not be following the restrictions as much as older people were tending to do.
It's the essential workers, the young, like this is the age group that works in jobs that they can't stay home from, right? There was a time when the youngest person in our ICU who was ventilated was 29 years old or something, right? Like that was a while back. And the oldest was 62. So that just shows you, right? Add to that the power of vaccines, right? Like what I really want to look at is you don't see large scale outbreaks, right? Like that we saw during the second wave. The other thing is in the entire long-term care system, we have handful of active cases of COVID-19. That tells you, you know, we literally vaccinated that cohort, that population as fast as we could, and we see this. So now it's whack-a-mole, literally whack-a-mole, right? Like, so this has shifted towards younger people, pregnant people, pregnant women. So we want to make sure that they are, they are vaccinated as quickly as possible.
Do you think we have enough vaccines to do it quickly enough so we can get things back on track late summer?
I would hope so. And, from what we heard from federal government yesterday, that instead of 1 million shots of Pfizer a week, we'll be getting 2 million, right? Something like that a week in May. So I really think May is the month where we literally kick this virus's butt. Say what you will, I think we opened up too early in the second wave. We never came down to baseline, and we are paying the price. So hunker down, like follow the public health measures, get the first shot available to you, right? Like these are safe and highly effective vaccines.